Hello to all 2022 CHS Health Research Symposium listeners. To begin describing the background of this study, it is important to note that aerobic capacity, or VO2, is a standard measure of firefighter fitness. Additionally, previous UWM HPSP lab research has indicated that there is a negative relationship between VO2 and step test cardiovascular workload, which would indicate that a lower aerobic capacity is related to a higher in-task workload. The potential relationship between that task workload and the subsequent post-task heart rate recovery is unknown, which would be important to understand if there is a relationship between workload and the ability to recover post-task, as it might have implications for training and workload management for firefighters. As such, the purpose of this study was to explore the relationship between workload, expressed as Edwards Training Impulse or ETRIMP, and heart rate recovery in firefighter recruits. For this study, 34 firefighter recruits performed a forestry step test followed by a 3-minute seated recovery. The forestry step test is a 5-minute sub-maximal step test in which a member steps onto a box and off of a box at a cadence of 90 beats per minute. Heart rate was measured continuously throughout the test and then used post hoc to calculate ETRIMP during the task, heart rate values at immediately post 1, 2, and 3 minutes of recovery, which was then expressed as a percentage of their predicted maximal heart rate. And finally, differences between those heart rate values were calculated and represented as heart rate percent change. Bivariate Pearson correlations were run with an alpha level set at 0.05 to determine relationships between ETRIMP and heart rate values. ETRIMP had a significant positive relationship with heart rate immediately post-task, 1 minute, 2 minutes, and 3 minutes post. ETRIMP also had a significant negative relationship with heart rate percent change between 0 to 3, 1 to 2, and 1 to 3 minutes of heart rate recovery. The results of this study would indicate that individuals with higher ETRIMP had greater heart rate percent change within 3 minutes of recovery. It is important to remember that low aerobic capacity has been previously related to higher ETRIMP during the step test. These results may be important to consider when working to optimize firefighter recruit academy training, considering that individuals with low aerobic capacity may have higher in-task workload, followed by large decreases in heart rate post-task than those with higher aerobic capacities, resulting in larger cardiovascular strain for those with low aerobic capacities. Future research should look to investigate whether changes in aerobic capacity correspond to decreases in ETRIMP pre- and post-academy, and investigate if there are other health implications to improving aerobic capacity, such as on metrics like blood pressure, glucose, and/or lactate production.